Food Insecurity in the United States, a deep dive into nonprofit food pantries. Through growing up in a low-income household where food was often limited and insufficient, young Desiree Murphy Morrissey and her family relied on the Supplemental Nutrition Assistance Program, SNAP, and local food pantry support as their meals. Nearly 25 years later, Desiree saw the impacts of the COVID-19 pandemic on food-insecure households and was inspired by the tough times she experienced at a young age. She began a local food pantry out of her backyard in Upper Darby, Pennsylvania, in which individuals would come to her home and receive baskets full of fresh produce and foods donated by community members and other local food pantries. 5 years later, Desiree's food pantry operates in its own building, staffed with volunteers and continuously supported through the local community. The food pantry currently feeds over 400 families, all beginning through Desiree's views that it is her social obligation to provide to those experiencing food insecurity and financial instability. Food insecurity is defined as the lack of or uncertainty of access to adequately nutritious foods, along with the lack of ability to acquire foods in socially acceptable ways. Specifically within the United States, in 2024, approximately 47.9 million adults lived in food insecure households, thus showing a prevalence of food insecurity as an issue within the U.S. In looking at food insecurity in the U.S., the two main strategies addressing this issue include governmental assistance and nonprofit work. Governmental assistance tends to exist at both the federal and state level, and in 2023 it was reported that the U.S. Department of Agriculture, USDA, spent nearly two-thirds of its budget on food assistance programs. The most commonly referred to food assistance programs in the U.S. are SNAP, the Special Supplemental Nutrition Program for Women, Infants, and Children, WIC, and the National School Lunch Program, NSLP. With these respective governmental food assistance programs working to alleviate food insecurity through certain eligibility requirements and target groups, this is not the only form of food assistance in the U.S. In addition to governmental assistance, nonprofit organizations, specifically in the form of food pantries and food distribution organizations, serve as an alternative to governmental assistance programs. Charitable food assistance programs first arose in the U.S. around the 1950s, as there was a larger share of Americans facing food insecurity that could not be resolved through governmental assistance alone. Nonprofit organizations operate in a variety of diverse categories and can be viewed as organizations that work to promote the common good or a specific societal benefit on both a local or large scale. Nonprofits do so in a way where they do not generate any profit for business or salary purposes. All earnings within a nonprofit organization are used to further advance its nonprofit purposes for a social cause. Nonprofits qualify for tax exemption, meaning that they are exempt from paying federal corporate income taxes under Section 501c3 of the Internal Revenue Code. According to the IRS, nonprofits across the U.S. receive tax exemption due to their work at promoting the greater good for society through charitable action. Nonprofits operate both through governmental grants and funding allocation, along with local and charitable contributions. In 2011, it was estimated that nearly one-third of revenue for 501c3 organizations came from governmental contracts and grants, showing the critical funding role that complementary governmental programs and charitable assistance provide for nonprofits. In regard to food insecurity in the U.S., nonprofits most targeted toward ending hunger and promoting food insecurity are commonly in the form of food pantries. Nonprofit food pantries are defined as organizations that distribute food to low-income individuals and households, including food to relieve emergency and distress. Food pantries can often be associated with food banks, while the distinction is that food banks tend to operate on a broader scale of collecting items and distributing them to organizations such as food pantries. While some food banks can operate with direct contact to individuals and households in need, food pantries tend to bridge this connection more clearly, as they directly interact with and provide food to low-income and food-insecure Americans. With food insecurity and hunger continuing to place a heavy burden on households across the United States, nonprofit organizations in the form of food pantries significantly alleviate poverty and food insecurity through their community-based efforts and programs while still respecting the dignity of all people. Food pantries are becoming increasingly more reliable and accessible for individuals and families facing food insecurity due to challenges regarding greater restriction on government food assistance programs in recent years. In a Washington and Lee University Shepherd Program interview, alumnus Mike White spoke about a powerful aspect of his work with nonprofit organizations. Through his own experience working directly with the Head Start program, he shared, quote, I wrote my first cover letter to get a job on the fact that kids in Head Start were eating pizza for breakfast that was paid for by SNAP dollars." End of quote. The harsh reality of many governmental food assistance programs, such as SNAP, is that these programs are unattainable in improving nutritional outcomes for individuals, and that they are unreliable in terms of continuous support for individuals and families. In a study published by the American Journal of Preventive Medicine, researchers found a positive correlation between receiving federal food assistance through SNAP and the prevalence of obesity. The U.S. government has taken action in recent years to restrict the foods that individuals receiving SNAP benefits can purchase. Yet, according to a recent study conducted, there is no statistical significance between these restrictions and improved nutritional outcomes for recipients. As a result, the inconsistencies and restrictions on governmental food assistance programs has paved the way for nonprofit food pantries to emerge as both a healthy and consistent option for food-insecure households. In a study conducted on the nutritional quality of food pantry distribution in U.S. states, researchers found that 77.3% of active pantry organizations sampled reported distribution of fresh produce for longer than 6 months. Additionally, food pantries provide an alternative source of food to governmental assistance, as in 2016 it was recorded by the USDA that nearly one-third of SNAP recipients also received assistance through local food pantries. In that same year, it was reported that 26.5% of food-insecure households utilized a food pantry, representing a 40% increase since 2001. As a result, with the uncertainties regarding governmental food assistance programs and recent restrictions and implementations these programs have faced, it is reasonable for there to be a strong shift in food pantry usage in recent years, especially with increased nutritional outcomes for pantry users. Additionally, nonprofit food pantries create a strong support system for reducing food insecurity in the U.S. due to their perception of localized community needs through outreach and local support. In general, nonprofits respond to local community needs through greater representation of minority groups, and also through serving as an intermediary between individuals and local political entities. Nonprofits, specifically in the form of food pantries, help to combat food insecurity in ways that governmental programs cannot, through localized support. Food pantries are able to cater their services toward the needs of those within the local community, specifically through partnerships with local organizations, culturally tailored services, and flexibility in terms of timing and hours of operation. Also, many charitable food organizations rely on donations from local community members, and oftentimes food pantries associated with specific religious affiliations are able to gain the most support through volunteerism, in-kind donations, and cash contributions. In a study conducted on civic engagement and the role of nonprofits within this, researchers found that nonprofits help to engage volunteers and donors, bring together community members, increase collaboration within the community and outside of it, and promote community awareness and access to resources. Beyond food pantries simply addressing food insecurity at a basic level, they do so in ways that create a sense of community and personalized support for both food insecure households receiving support and for other community members. As a result, food pantries are able to respect the dignity of all people they are serving through personalized support and a humanized experience for food pantry users. Food pantries serve as a strong intermediary between local entities and those who need support, thus bringing to light issues facing community members. Similarly, food pantries are a strong point of contact for individuals facing food insecurity and a more humanized experience where individuals can receive support in terms of food assistance, but also in regard to physical and mental health resources, child support services, food delivery, and shelter. Through my own experience volunteering at a church-affiliated food pantry that provided both meals to individuals and also non-perishable groceries, I saw firsthand how food pantries provide the opportunity for individuals to receive support in terms of resources other than strictly through food and nutritional support. Oftentimes, when I would serve meals to community members, on a basic level, I could tell that the individuals I served enjoyed telling me about their life stories, about their families, or just engaging in conversation with me. It helped me as a volunteer to be more aware of their needs and engaged as a community member, and it also helped me to connect them with other local resources or support other than those offered by the food pantry. Oftentimes, the individuals I served would tell me about some of the issues they were facing, such as struggles in terms of health, housing security, and child support. In a 2022 study by the USDA, researchers found that for food-insecure adults ages 18 to 65 years old, they were more at risk for the development of chronic diseases. Furthermore, food insecurity not only affects the prevalence of disease and negative health outcomes among adults, but it also can lead to negative effects for children within these households, such as increased levels of obesity and mental health issues. Similarly to my experience in helping to foster a sense of community and openness through my time as a volunteer, a 2024 report showed that clients who received assistance from local food pantries in Cook County, Illinois, were more likely to feel well treated through receiving positive support from these food pantries, thus reducing stigma associated with relying on others to satisfy their food and health needs. Through this notion, food pantries help alleviate some of the stigma associated with receiving help in terms of food insecurity, and they also help households connect with other organizations to receive support in areas other than just food insecurity. On the other hand, due to nonprofit food pantries relying on local support and donations and volunteerism, food pantries can face significant financial hardship and staffing shortages due to inconsistencies in support. In a study conducted on food pantries in New York City metropolitan area, researchers found that out of the 88 food pantries listed online as open, only 25 of these food pantries were actually open when researchers visited them. Oftentimes, these shortages in hours of operation were attributed to inefficiencies in food available for pantry users, along with staffing and volunteer shortages. Additionally, with strong surges in food pantry usage in recent years due to federal food assistance program funding cuts, food pantries have experienced supply issues as they suddenly have a strong influx of individuals, but not enough resources to provide food for all of the new demand. Although these are concerns for the operational and foundational aspects of food pantries, there are many safety nets and ways to prevent these financial hardships from occurring. Specifically, food pantries and charitable organizations receive donations from community members and individuals due to the incentives associated with charitable contributions, which helps to increase the supply of donations to local food pantries and combat shortages. In some cases, community members choose to donate to local charitable organizations such as food pantries due to the deductions of charitable contributions on a taxpayer's adjusted gross income, thus lowering their taxable income. While there are also many concerns about surging food pantry usage during recession and financial instability for households, qualifying food pantries are able to receive support from the Emergency Food Assistance Program, a governmental program which helps minimize costs for food pantries to provide food insecure individuals. The incentives for local support of nonprofits along with safety nets for food pantries help to eradicate the inconsistencies that food pantries face in terms of possible financial instability. Another issue that deters food pantries from effectively diminishing food insecurity in the U.S. is the difficulty for low-income individuals to access these pantries. This can occur due to lack of information technology, transportation, or associated stigma with receiving support from food pantries. In a study conducted on the emotional aspects associated with food insecurity, an anonymous participant facing food insecurity noted, quote, "It's extremely painful, like I failed to overcome my life challenges to the point where I can't even provide myself with food. And that's a really painful thing to admit to myself and other people," end of quote. Many barriers to food pantry usage common among individuals include not being able to choose their own food, lack of access to transportation, conflicting hours of operation, and restrictions on food pantry usage. Although these concerns create barriers for some individuals, many food pantries and larger food distribution organizations are finding ways around this, such as through food pickup services, delivery services, and other alternatives. According to Feeding America, food delivery programs initially started around the time the COVID-19 pandemic began, and they ensured that individuals facing transportation barriers and mobility issues still had access to the benefits of food pantries. Another benefit of food pantry usage comes from the notion of survival networks as developed by researchers Mario Small and Leah Gose. Essentially, these researchers observed the trend that low-income individuals form networks of relationships around certain local institutions, creating a source of emotional support, information exchange, and sense of belonging. As a result, while food pantries create certain barriers for food insecure individuals, the net benefits of food pantry usage can be seen through survival networks and also through food pantries and organizations using alternative methods such as delivery services and initiatives. Overall, with food insecurity affecting a large proportion of Americans historically and in the modern day, it continues to be a pressing issue that food pantries are attempting to address in ways that governmental programs and other initiatives cannot. Food pantries are unique in the humanized experience they provide for food insecure individuals, and through relying on charitable contribution and volunteer staff to lessen the burden that food insecurity places on Americans. Through localized support, community-based effort, and greater restriction on governmental food assistance programs in recent years, food pantries are becoming more widely used and available for food insecure households in the U.S. Although food pantries cannot serve as the only solution to alleviating food insecurity in the U.S., they are effective in reducing the prevalence of food insecurity in a more personalized way that respects the dignity of all individuals.